Well, we can endure all sorts of pain throughout our life, but chronic joint pain, man, that is a kind of pain that can really sideline you in a hurry from whatever it is you want to be doing. But you can get back in the game with help from my next guest. Dr. Adam Schwartz is an orthopedic surgeon with Arizona Sports Medicine Center. Thanks for being here today.
Thank you for having me.
Joint pain is a big deal to a lot of people. We're going to get to the benefits of these procedures in just a minute, but let's start with Arizona Sports Medicine Center. Who are you guys and how long have you been in the Valley?
So Arizona Sports Medicine Center is a group of orthopedic surgeons with a lot of years of experience. It's been in the Valley over 20 years, and we are all orthopedic surgeons that are looking to help our patients get back to whatever they want to do. If they're younger, getting back to playing sports, and if they're more advanced in age, getting back to playing with their grandkids and anything that they want to do.
I mean, just general movement, right? Pickleball, doing things around the house, things that they used to be able to do that maybe this pain has kind of made impossible or really difficult for them. So you have performed literally thousands of these surgeries in your career. Talk to me about what these procedures can offer your patients on the other side. I think it's very intimidating to go into a surgery, but there's big benefits once it's done.
Yeah, so it's more than just the nuts and bolts of the surgery for me. Obviously, most of the surgery is geared towards helping patients get back to their best functional status and reduce pain, but it's even more than that. It's getting back to the things that bring them joy in their life.
Yeah, that general mobility, that quality of life is really important. It keeps us young when we can stay active, right?
For sure.
You have published extensively, you've taught, you've spoken at conferences, you've been out in the community of fellow professionals in your field. How has this changed the way you approach these procedures?
So for me, it's all about staying current and being up to date on the latest and greatest in orthopedics, bringing those advancements and innovations to my patients to try to accelerate their recovery, to try to improve their outcome. But it's also about having the experience of actually running research programs myself and knowing how to critically evaluate the new things that come out. And some things are great for patients, other things, at best they can add a lot of cost, and at worst they can actually, be harmful. So we want to separate the wheat from the chaff.
Well, and I love that you brought that up because, as I mentioned earlier, I think this can be an intimidating procedure to approach because 15, 20 years ago, these procedures would leave you in the hospital for a handful of days. The recovery was a lot harder. So all of this research that you guys are doing and the technology that you're seeing has made these a lot simpler and the recovery is a lot nicer for your patients too.
Yeah, for sure. I mean, when I trained over 20 years ago, it was pretty common for us to keep patients in the hospital 5-6 days at a time. And, now patients, 90% of patients will go home the same day or stay overnight and go home the following morning.
And that shared decision making, you and I were talking about it earlier and you mentioned it, you talk about the options for your patients and what would work for them, what makes sense for their case. That's a really important aspect of the entire process.
Yeah, for sure. I mean, it's really a partnership, and one of the things that brings me joy in practice is really understanding why my patients are there and what they're looking to bring back to their life and how we can help them. And every patient's different. Every patient has a unique combination of treatments that can unlock the goal for them.
Yeah, and I love that you are able to have those discussions and really demonstrate through the technology and the computerization, show them before the surgery exactly what it will entail. Doc, thank you so much for being here. It's really cool to see how things have changed and how you're able to get people back on their feet and doing what they love to do. So thanks for being here. Arizona Sports Medicine Center is located on Union Hills in Glendale. Give them a call at 480-420-0749 or visit asmcmd.com for more information.